Thank you for joining us for this special edition of KPBS News. I'm Maya Trabulsi, and this is the week many businesses took a major step backward. New restrictions are in place for a variety of indoor operations. Fitness centers, places of worship, offices for non-critical sectors, personal care services, hair salons and barbershops, and malls have all had to scale back. The state has included more than a dozen counties on a watch list as COVID-19 cases continue to rise. KPBS reporter Shalina Chatlani tells us how San Diego is trying to make it easier for these businesses to operate outdoors.
I'm seated outside of the Tofu House in Kearny Mason. If you look around, you'll see that these tables and chairs look like they've been here for a really long time. But if you zoom out, you'll see this is actually a part of a parking lot. It's the type of solution that's been proposed by the city of San Diego to help small businesses expand their operations outdoors, while the state has mandated that indoor activities shut down due to coronavirus.
I have been impressed. I have been impressed with their incredible resolve and their resilience as they continued to be whipsawed with state orders to close and reopen, close again.
San Diego Mayor Kevin Faulconer announced an expansion of an already existing order to let some businesses shift their operations outdoors into nearby street parking, with some new urgency given the state's decision this week to tell businesses to close indoor operations yet again.
Specifically, it waives special event application processing fees, fire inspection fees for street closures, and any late fees. It also retroactively waives fees for businesses already approved after May 1st.
Still, with the pandemic raging on, there are concerns of whether the expansion could mean risking COVID spread, especially when it comes to minority-owned businesses that could employ essential workers and people of color who are already especially vulnerable. The city says it's working closely with the Strategic Alliance of San Diego Ethnic Chambers of Commerce.
We work with these businesses on a daily basis, walking them through the process, doing things in language, and making sure that not only are they following all the health and safety guidelines, but they're opening properly.
Jason Paguillo is with the Asian Business Association. He says the partnership will be working with minority-owned businesses to ensure safety for workers. And the city says it will also be monitoring sidewalks.
Once you have your pedestrian parklet or sidewalk cafe expansion in place, we're going to go out and inspect it to make sure that it's going to be safe for everyone to walk through.
The city plans to allocate $300,000 in funding to the ordinance. Shalina Chatlani, KPBS News.
With this new wave of shutdowns, authorities are bending rules and using creative solutions to help keep businesses afloat. But not all businesses are created equal. Hairdressers and barbershops are finding that even bending the rules may not be enough.
At a new twist salon in Poway, Ellie Blomgren walks us through the steps she takes to keep clients safe. She and her husband have owned this salon for 7 years.
This is beyond no words.
With this second shutdown, many businesses have been allowed to move outside, like this CrossFit gym that shares a parking lot with a new twist salon, as well as this now closed barbershop next door. But the State Board of Barbering and Cosmetology sent out an announcement reminding personal care businesses that they're not approved to cut hair outside of their licensed establishments.
State of California can give us whatever leeway they want to, but if State Board tells us, no, you can't do that, they're our governing body. We have to do what they say. And we either get fined, we can actually lose our license.
On Tuesday, Mayor Kevin Faulconer and Councilmember Chris Cates sent a letter to the office of the governor asking him to take executive action to allow these businesses to work outside.
I wouldn't want to work outside. We're limited as far as, what we can do outdoors. We can cut hair, but we can't do color. We have to have somewhere to rinse them. And in the 80-degree weather, I can't imagine doing hair outside or having our clients be comfortable sitting outside in that heat.
Can you make a living just cutting hair?
No. 80% of my business is color and cuts along with those colors. So if I was to cut out all the colors, I would be at 20%.
Blomgren says that if any amendments are made, it should be to allow hairdressers to work in the safety and comfort of their salons.
I don't think they understand how safe people are when they come in here. I mean, I feel I'm safer in this environment, and my clients are, than going into a grocery store. Sorry, but in the grocery store, you're exposed to a lot more. Here, you're controlled. It's you and your stylist. They don't understand what we've done to make it safe in here. I don't understand why outside is better. I just don't.
And this week, the county reported the first community outbreaks connected to a barbershop and a hair salon. And it's not just a slowdown in business making headlines. On Thursday, San Diego County reported 17 new deaths from COVID-19. That's a one-day record since the first local death in March. Overall, we have seen more than 21,000 cases and 460 deaths. Uncertainty for families will extend into the fall. San Diego Unified Schools will stay online only, but other districts will welcome students back to campus. More now from KPBS education reporter Joe Hong.
While the national debate continues over whether students should return to school campuses while the pandemic rages, local districts are making their decisions.
Things are beginning to crystallize better.
Francisco Escobedo is the superintendent at the Chula Vista Elementary School District. His district decided not to reopen physical campuses and to start with online instruction in the fall.
Seeing these increasing infection rates, seeing that the curve is going up instead of going down, we had to, at least for now, have a distance learning possibility.
Escobedo said he's not committing to any timeline for reopening school sites, but he said a significant drop in infection rates and increased testing capacity are crucial for a safe return to campuses.
I would hope it's the second or third week, but it's hard. I can't pinpoint a time frame until the indicators tell me that it is time to start coming back.
The Sweetwater Union High School District, which serves many of the same neighborhoods as Chula Vista Elementary, is also planning to go fully online in the fall. But up in Poway, schools will welcome students back to physical classrooms.
Our district plan is to move forward with reopenings.
Marianne Kim Phelps is the superintendent of Poway Unified School District. She said students will be able to choose between in-person, online, and hybrid instruction. The district has installed plexiglass barriers and new ventilation filters at all of its schools.
We've ensured that we've ordered all the PPE and disinfectants necessary. We have staff going through training. There's a lot of things to take in consideration that we're working really hard to ensure that we do.
Kim Phelps added that the district made its decision after getting input from the community.
This is what our students need, and this is what our community is asking for. And so I think that every district needs to react and be prepared to serve the children that they're responsible to serve.
Also in North County, San Marcos Unified is planning on offering in-person learning in the fall. The Oceanside and Vista districts are considering it and will have a clear idea after the next school board meetings next week. In the East County, Cajon Valley Union School District and the Santee School District are planning on reopening campuses. Joe Hong, KPBS News.
Delayed testing results aren't just a trend in San Diego County, but nationwide. Officials say that's because of increased demand and supply shortages. KPBS reporter Matt Hoffman says the county is trying to work around the roadblocks.
It's business as usual at one of San Diego County's COVID-19 testing sites. This one is in a University of San Diego parking lot and is by appointment only. It's one of the new sites using tests from local biotech company Helix. The county is partnering with them to do 2,000 tests per day quickly.
It's a PCR-based test, and that includes a full non-invasive collection kit, which is processed in our clinical lab, and results are returned the next day.
Recently, the county has been able to scale up its testing, but labs like Quest Diagnostics say a nationwide trend of increased testing is slowing the time to process test results. There's also a nationwide supply issue, meaning unless you're a priority patient, people could be waiting 7 days or more for testing results.
We know that's not acceptable. They're trying to do better.
New state guidance recommends prioritizing testing and test processing of hospital patients with symptoms of COVID-19, followed by other symptomatic and high-risk people who may have come in contact with the positive case. The county is prioritizing tests in the same way.
So we're going to have more people to be tested that need to be tested. So the county testing with Helix now getting up to 2,000 a day is actually going to allow us to possibly do the same and if not more testing.
The partnership with Helix takes pressure off the county lab and means it can focus on processing tests related to outbreaks. But processing tests requires adequate lab staff and testing equipment.
We are ramping up, our lab staff, and many of our hospital partners and even community clinics are doing 3 shifts, 7 days a week to try to meet the demand, but also testing equipment. And there's a backlog on testing equipment.
The county says most tests taken to its lab are processed within 24 hours for high-priority patients. It could take up to 3 days for others, but keep in mind the county is not doing majority of the test processing and they have to rely on others.
That represents maybe 30-35% of the county lab. The rest of it, the lion's share of it, is our hospital partners that are doing testing, and then of course the commercial labs. Rest assured that the county lab, our hospital partners, our lab testing task force is working together with our commercial labs and now our new partner with Helix to meet the needs of our county region.
The county says because of supply shortages, they were at risk of closing some of their testing sites, but thanks to this new partnership with Helix, they can now stay open. Matt Hoffman, KPBS News.
More than 400 local families have lost someone to COVID-19. Those sudden deaths leave behind questions about what went wrong. iNewsSource investigative reporter Mary Plummer has the story of one family in National City.
Mistakes, slow testing, and poor care. These are some of the problems the families we interviewed faced during the final days of their loved ones.
This is Joseph Bondok's story. The Navy veteran died May 21st of COVID-19. He was buried with military honors at Miramar National Cemetery, and his family was there. But Joseph died alone in a Boston hospital. After retiring from the military, he became a civil service mariner. He was home on vacation with his wife and 3 kids in National City when he got a call that he had to report to Boston in March to do maintenance on a Navy ship. About a month after he arrived, he started feeling sick. A positive test ultimately landed him in the hospital. His wife, Wichelda, unable to travel, was stuck at home.
We cannot even eat and sleep because we keep waiting for the what's the update. We're just hoping every day for a good news. And when I called, when I hear what's news and it's not good, I was like getting black and I couldn't understand anymore what they're saying.
As his condition worsened, the family wrote letters to God asking that he be healed.
This is from Joseph. We prayed day and night. Our kids were hoping for him to go home. We even prepared for his homecoming. And this is from Brad.
It was so sad that most every night I almost cried. I really miss him right now. Like he was like a loving and caring dad.
Joseph spent the last 2.5 weeks of his life on a ventilator. Unable to talk with his family, he was 54 when he died. Wichelda spends her days grieving and wondering and taking care of their kids. She says Joseph told her masks were not required on the ship or provided until the 2nd week. And at first, no social distancing was in place. In all, 24 of 47 crew members tested positive. Wichelda wonders why the work was necessary in the midst of a pandemic.
I was thinking, what if they just let him finish his vacation? I think he's maybe still alive now. And why they have to recall everyone and not to secure or guarantee their safety.
Wichelda remembers her husband through photos and keepsakes, pictures from their wedding day in the Philippines, photos of the family at the beach in Coronado. She says he had hoped to retire soon.
The Military Sea Lift Command, which maintains the Navy ship where Joseph got sick, declined our interview request. In a statement, the command said tactics to fight the virus evolved and repair work on ships had to continue. For KPBS, I'm iNewsSource investigative reporter Mary Plummer.
For more on other lives lost to COVID-19, go to inewssource.org. iNewsSource is an independently funded nonprofit partner of KPBS. Local law enforcement agencies continue to not punish those who are out in public without a face covering. That's despite the countywide rule requiring them. KPBS reporter Claire Tregesser checked in with every local police department and has this report.
A KPBS reporter visited Mission Beach and the Pacific Beach Boardwalk multiple times over the weekend and saw more than 100 people not wearing face coverings while walking on the sidewalks, riding bikes through the crowd, or waiting in line for a restaurant. Despite this, police remain reluctant to issue citations for violating the order. In June, San Diego Police Department officers issued just 3 citations, and the Metropolitan Transit Service issued 1, according to a KPBS review of police records. None of the other 13 police agencies in the county issued any citations in June. In May, only 3 citations were issued countywide. Police have said they are hesitant to issue citations because they worry about coming off as heavy-handed and damaging their already fragile relationship with the community. Also, they say the county's public health order is very difficult to enforce. The rule says people must wear a face covering when out in public and within 6 feet of another person who is not a member of their household.
It's real hard for us to know who's a member of the household and who's not a member of the household.
Lieutenant Sean Takeuchi is a spokesman for the San Diego Police Department.
I think generally people might envision families, right, where you've got a couple and you've got maybe kids, and those are quite simple. But it becomes a little difficult when it's not a family. When you've got the Pacific Beach area, where you've got several people that might be living together as roommates, and they're hanging out together. How do we as law enforcement officers are supposed to know that they're members of the same household? We don't.
He says officers sometimes stop people in big groups and ask, and if the people say yes, the officers take their word for it because they can't require people to carry IDs. Claire Tregesser, KPBS News.
The state is reaching out to Spanish-speaking residents in a new public service announcement. People are urged to wear a face covering to protect their families. Communities of color have dealt with higher rates of infection from COVID-19. The PSA reminds younger people who might feel less vulnerable that they can easily pass along the virus to an older friend or family member. And the coronavirus pandemic's disproportionate impact on Black and Hispanic communities has highlighted long-existing health disparities. KPBS health reporter Taryn Mento digs into the history of how inequities developed. She speaks with Dr. Cheryl Anderson of UC San Diego Center for Excellence in Health Promotion and Equity.
San Diego City Heights neighborhood is seeing a higher rate of coronavirus cases than the rest of the county. And it's the same story in Southeast San Diego. These communities that have higher rates of Black and Hispanic residents are where the nearly century-old and now illegal practice of redlining occurred. That's when a government-backed body marked maps of predominantly minority communities in red and labeled them a poor financial investment.
Black Americans being essentially by policy forced to stay in one part of a community, and white Americans being encouraged and supported in staying in another part of the community.
UC San Diego's Cheryl Anderson joined me outside the School of Public Health, where she's dean, to explain how this anti-Black policy led to the health disparities we're seeing today in Black and even Hispanic communities.
The start lines are different, and so you now have certain neighborhoods that by sheer structure and design don't get resources.
She says those disproportionate jumping off points became exacerbated over time.
And then you look up and you see outcomes, whether they be educational in nature or health in nature, and you say, oh, it must be that there's something wrong with Black people because Black people are having these poor outcomes. No, Black people were by policy forced into neighborhoods that were not developed, that were not invested in.
Give me a specific example of a lack of investment.
So you have a policy around housing that then settles people in a neighborhood where it is more likely to have tobacco and alcohol sold to you, where you are less likely to have green space and be physically active, where you are less likely to have access to grocery stores that allow you to nourish yourself in ways that are more adequate.
She says this goes back to zoning and planning decisions.
And then the chances of you developing high blood pressure, diabetes, lung disease are increased.
The center Anderson leads works with groups here in City Heights to provide better healthcare access. And it also established community gardens to provide healthier options for the area. But Anderson says that's just a small part of what needs to happen.
The real deal is when we take a justice approach, which is to really understand what is the barrier, what is the reason, what is the root cause for us seeing the outcomes that we're seeing, and removing those systemic barriers so that people can actually have, the ability to get to that better outcome.
I asked Anderson if there's anyone, anywhere, doing the work to counter these barriers. And she brought up the recent news that certain sports teams are rethinking their mascots that people have long pointed out are racist.
They're rethinking it because certain businesses are saying, we will not advertise, we will not support you if you continue to have this practice. And so I think what needs to happen is we need to think about this from a systems perspective. And we're all accountable. We all have a role here. And so when you see the power and the privilege beginning to listen and say, this is not okay, we have to figure out how it is that we're going to turn this around.
There might be some people out there, business owners or individuals, who have nothing to do with healthcare, who have nothing to do with providing resources for a community, who may think that they are exempt from having to take any action because they're not part of what created it and they're not part of the system that can directly fix it. But it sounds like with your mascots example, you're saying that's not the case.
If you are supporting a community practice that has racist historical origins, racism is not a deal breaker for you. So you may not be racist, you may not be practicing or engaging in a racist moment, but is racism a deal breaker for you? And if racism is a deal breaker for you, then the way you vote, where you spend your money, and how you exercise, your time and energy will somehow be engaged in trying to help us address this issue of racism.
Anderson is penning an op-ed on the actions an individual can take. Taryn Mento, KPBS News.
When it comes to sports in San Diego, it's been one step forward and one step back. The Padres are making progress. This week, the team started holding intra-squad games at Petco Park. They're getting ready for the return of Major League Baseball. A shortened 60-game season is set to begin next week when the Padres host the Arizona Diamondbacks Friday night. For the first time in its 50-year history, Comic-Con International has had to cancel its pop culture convention and move the event online. KPBS arts reporter Beth Accomando explains what you can expect from the virtual experience.
Comic-Con at Home boasts no lines, badges for all, and front row seats.
We've been working pretty hard, actually, trying to translate the physical show to an online endeavor.
So now you can download badges for you and your pet, create your own front of line, and even play familiar Comic-Con announcements at home.
Please fill all seats. Do not hold seats for other people or place items on the seats next to you.
But there's no way to sugarcoat this, says Funko Vice President Michael Becker.
Physically not being there and interacting with people is not going to be as good.
As a manufacturer of pop culture collectibles, Funko has built a community of avid fans while exhibiting at Comic-Con.
That's really what drives Funko and Comic-Con is really the community. I mean, I think you take all the stuff out of the equation. I think most people just look forward to seeing their friends and family once a year in San Diego. I think that's bigger than the stuff.
But this year, fans will have to make do with an online experience. Comic-Con at Home offers more than 300 panels and virtual versions of Artist Alley, Small Press, and the Exhibit Hall. IDW Publishing is ready to go online with panels and exclusive comics, says its president, Chris Ryle. But he misses having a booth where he can interact with attendees.
Just getting to sort of see the joy in their eyes, too, when they're meeting Kevin Eastman or they're meeting, whoever else they're talking to. Those are all the things that just are impossible to replicate. So the thing that I miss from that is, again, just the spontaneity. If somebody walks up and they have a kid with them and their kid likes this, so what else might that kid like? And you can recommend and put in their hand this thing and they can flip through it and see that, that might be a cool thing.
But for the better part of a decade, it's been difficult to get into Comic-Con. So this virtual convention will be far more accessible.
There'll be a lot of people that for the first time get to at least get a little sense of what Comic-Con might be about by being included in some of the panels. Now they just can click on and hopefully be able to enjoy and participate in what a Hall H kind of might be like without having to fly here, stay in a hotel, camp out for 2 days.
With Comic-Con at home, there's simply no excuse not to attend some of the wildly diverse panels. There are even tutorials like cardboard superheroes from brothers Connor and Bauer Lee that you can follow along with at home.
Also, I recommend using the edge of your table when you curve your piece because that way you can get a smooth curve.
So we created printable templates that you could just print out, cut out, and create some of these models. And also along with that, we created an instruction video that teaches you how to create a specific model.
These tutorials grew out of the teenagers' love for superheroes. And that highlights how the people involved in Comic-Con, from the panelists to comic book publishers to the folks running the show, are all just geeky fans. And that's part of the appeal.
All of us are definitely entrenched in the world of geekdom, and I don't think that ever goes away.
Comic-Con at home lacks the in-person component, yet it may provide an opportunity to expand the geek community in new ways.
It should be a fun event. It'll be different, but it'll still be Comic-Con.
The exhibit hall is now open to attendees. Have a great Comic-Con.
Beth Accomando, KPBS News.
And that's all for this special edition of KPBS News. For all of us here at KPBS, I'm Maya Trabulsi. Thank you for joining us, and stay safe.